I'm a single parent and a musician. I work as a freelance musician and church musician, and none of my jobs offers health insurance. So I'm on Minnesota Care and my kids are on medical assistance. But when I work extra hard and I earn too much, I can't be on Minnesota Care, and I can't afford to buy a private policy. So at those times, I go without health insurance, which is really frustrating and stressful. I feel like I'm being penalized for working harder. And I feel like because I'm in a non-conventional career, I don't get to go to the doctor.
The Commonwealth Fund, which studies healthcare systems throughout the world, has found that up to 84,000 Americans die every year from preventable causes because they can't get through the door. As a practicing physician for over 36 years, I had the privilege of caring for thousands of patients. Most of these patients were fortunate enough to have the means to access the healthcare system, but at times there were patients who delayed their care because they did not have the means to access our healthcare system. And these patients presented with advanced cancers or complications that could have been prevented if they'd had the ability to access our healthcare system earlier. We are the wealthiest country in the world. Don't we have a moral obligation to prevent this needless suffering and death?
I know this is a complex issue, but if I had health insurance, I would have more power over my life. I would be able to contribute more to my community, and I would earn more. Not only is it unethical to draw a line in the sand and say who deserves health care and who doesn't, it's also not smart. We're holding back entrepreneurs, small businesses, and we're punishing families who are trying to escape poverty. It doesn't have to be like this.
For 42 years, I've been a registered nurse, and I've cared for all ages, from infants through seniors. In the last several years, I've been a diabetes nurse, and I saw many struggle to pay for insulin compared to basic necessity needs like gas in the car, groceries, a house payment, or rent. As a result of this, many became homeless and highly mobile because of this extreme financial burden. And as a grandmother and nurse, I am also deeply concerned about infant mortality rates in the United States that are higher than any other developed country. I say enough. It is time to have quality, accessible health care in the United States for everyone from birth to death.
Since 1965, Medicare has provided health care to over 57 million Americans and include dialysis patients. And it has done so at an administrative cost of 3% compared to 30% for insurance companies. We could have the best healthcare system in the world. We already have a stellar infrastructure that's in place. We have the best educated providers in the world, excellent medical facilities, superb researchers, but there are barriers in place. There are underinsured patients, patients that lack insurance. We have the rising cost of deductibles and copays. We have the in-network and out-of-network problem. It is because of these barriers that 1/3 of Americans aren't able to enter that door and obtain the health care they need.
But there's good news. Hiding in plain sight, there is a solution. Improved Medicare for All, from birth to death, and we can save money while doing this. With an improved Medicare for All program, we can save, for a statewide program, over $4 billion a year. A nationwide program, over $500 billion.
Ultimately, caring for each other is an act of love, and everyone is worthy. Now is the time to do the right thing, the smart thing, and make improved Medicare accessible for all.